This is Insight and Beyond, brought to you by Moorfields Eye Hospital Dubai, a podcast where knowledge meets curiosity. World-leading experts in eye care will dive deep into the world of vision, health, and insights in innovation. Each episode is a step into the future of healthcare and more. Tune in, get inspired, and see the world differently.
Welcome to another episode of Insight and Beyond. My name's Katie, I'm Head of Education at Moorfields Eye Hospital, and today I'm joined by Dr. Alia, consultant ophthalmologist specialising in oculoplastics and aesthetics. Welcome, Alia.
Thank you very much.
So today we're going to be talking about summer eye care. As we head into the summer months, everything's getting a lot hotter, the AC's going up. What would you say is especially important to sort of focus on when we're thinking about eye care?
Well, that's a really interesting question. Well, when it comes to summer in general, the most important thing is definitely sun protection. So I would always recommend to wear sunglasses when you're outside, and also use sun protection around the eye. You know, I'm an aesthetic oculoplastic surgeon, so one of the most common questions is like, oh God, I have wrinkles around my eyes. The most important thing basically is to protect your skin around the eyes, because it's so delicate and sensitive.
Excellent. So when you're looking at sunglasses, are they all the same, or do I have to look for some special sort of...
No, definitely you have to look for certain specifications on the sunglasses. I would definitely make sure that you go to a licensed optical shop where they can advise you on the UV protection. There are also special signs on the glasses that show you that those glasses are well capable of protecting you from the sun.
So for adults, I think that's very straightforward. Yeah. But as you're probably aware, trying to keep sunglasses on younger children is very difficult. Have you got any other words of advice for parents trying to keep sunglasses on kids?
Well, you know, when it comes to sunglasses with children, you're right. Absolutely right. It's really, really difficult. Simple tip would be just... You know, some kids, they actually like sunglasses if they can choose them themselves, you know, like giving them the choice. There are also some straps that you can put on, especially when you're at the beach, so that they can use them. And if they really don't want to wear them, at least have like a proper hat that will shade.
With a brim.
Exactly.
Yeah, makes sense. Okay, good stuff.
Yeah.
When you're working in the clinic during the summer months, are there conditions that you see more regularly as you're sort of working through your day?
Yeah, well, I mean, we're here in Dubai, right? So most of the people are actually aware of the sun, and they do use their sunglasses. But because it's quite warm in the summer months here, we're exposed to a lot of ACs, obviously. And this can often trigger dryness and irritation of the eyes. So one simple thing that I tell my patients is, like, even when they're in the car, they shouldn't have the AC blasting fully onto their face, because that will enhance the evaporation of the tear film, make their eyes more dry. Just think of it like having constantly a fan into your face. It will eventually, you know, dry out your eyes and make them feel drier and red and more irritated. So have the vents not directly into your face. Also keep more attention on lubricating your eyes in those situations, because the patients, they will notice it, right? They feel like the eyes feel a little bit gritty. They're a little bit more red. They feel like they have to blink a lot. And sometimes, absurdly, they even get teary, right? So I have patients who come in, it's like, how do you think my eyes are dry? I'm tearing all the time. And that's actually a reflex, you know, when the eyes are dry, it's like a protecting mechanism. I always like to explain it in a way where I say, well, imagine having your mouth open all the time. Eventually you will start to drool, right? So that's pretty much how I picture it. So your eyes will start to water because your eyes want to be protected. No.
And I guess the same would go for vents and things when you're actually in the office as well.
Exactly.
So all your AC vents should be sort of not straight into your face.
Humidifiers also help too, because the ACs, they kind of dry out the air. Now we've noticed this a lot also in airplanes, right? Did you notice ever when you're in the airplane that your eyes feel really, really dry? That's because the humidity is really low and you have the vents above you. So when you're in your office or even at home, have a humidifier. That can really help. Doing warm compresses also can help to basically stimulate the oil glands of your eyes to get a better tear film. And of course, you know, eye drops help as well, like hyaluronic acid.
And can you just continually use eye drops? Is there any kind of, you can use them as and when, it's not a... something that you can only...
So I would definitely make sure that you use preservative-free eye drops, because, you know, the preservatives in some eye drops, they can eventually lead to some reactions over time and so on. So I would always opt for preservative-free eye drops.
Yeah. And then on that one as well, is there any kind of correlation between dehydration? So should people be drinking more, obviously, during the summer months? But will that also have an effect on eye health?
I mean, look, in general, it is really important to be hydrated, right? But drinking more water doesn't necessarily make your eyes more lubricated.
Okay. Fair. But obviously we would suggest, especially over the summer months.
Yeah.
A lot of us travel over the summer months. A lot of us are heading to the beach. Have you got any safety tips for parents who are taking children to the beach with sand? You know, it's a age-old problem with children getting sand in their eyes. What should we do in those sort of situations?
I would always have some eye drops with me, and maybe even, you know, like, I mean, children, they play with the sand, right? So if they wear sunglasses, this could protect them, because, you know, they splash with the sand.
Yeah,
and
as much as we try to stop them, absolutely.
Right? Exactly. If you don't have eye drops handy, just have clean water with you, bottled water, and then you can wash them out for sure. Like, have something like that handy, just in case.
So when you're travelling, we all can travel mostly when we've got children with some sort of first aid kit. You would always suggest having a small eye wash type of...
Yes, I would.
And that's just a saline solution?
A saline solution would be fine in that situation, because you just want to wash the sand out, because the sand sometimes, you know, it gets stuck under the eyelids and it's really, really irritating. I had this situation once, me as an eye doctor. I was like, the one time where I didn't bring anything with me, the kids were playing in the sand, and obviously they got all the sand in their face, and I was like, oh, God.
Yeah, sure. So just to make sure you have those with you. It's a really good tip. Yeah. And then, obviously, the other thing that we do whilst we're on holidays is we spend a lot of time, both ourselves and our children, in the swimming pools.
Yes.
As we know, as healthcare professionals, they are a bit of a melting pot of infection potential. Yeah. Are there any tips that you've got for swimming pools and safety around the swimming pool?
Yeah, well, I would definitely advise to have swimming goggles, right? Because especially children, they love to open their eyes under the water. Yeah. It's like their favorite thing to do. I used to do it too when I was a little kid. Now, if I go into a swimming pool, I can't open my eyes because But so have really good swimming goggles for yourself and for the children. And if you were to use contact lenses, don't use them in the pool.
Good tip.
Definitely don't use them in the pool, because this is something a lot of people do. They're like, oh, well, but I'm at the swimming pool and I want to be able to see because I can't go in with my glasses. There are prescription goggles, so if you really, you know, have a high short-sightedness or far-sightedness, then you can also, for children, opt for prescription goggles that they can use safely in the water. They can swim with them. They can do all this. So you don't have to opt for the contact lenses.
Yeah, that seems like a very good idea. And when your child, I mean, we've all been there as well, where they've had a whole day in the swimming pool, they come out, their eyes are very red. Is that because, is there a reaction to the chlorine? Is there something that we need to worry about, or is that something that will just generally settle by itself?
You know, so it is like, especially if they've been swimming under the water and keeping their eyes open, then definitely the chlorine can irritate the eyes. In those situations, I often advise to, use some, like, you know, take a proper shower and use some artificial tears to kind of rehydrate the eyes and lubricate them properly.
And I guess just do it as more of a preventative, so they don't get to that stage as well.
Sometimes I say, you know, like, put a lubricating before and after, and just like make sure that you don't open your eyes underwater.
And then the other thing, especially if we're going to European countries where the pollen is very high, I know a lot of people, myself included, whose eyes start to stream as soon as we get off the plane if the pollen count is high. What advice would you have for people that suffer from those kind of allergies during the summer months?
I mean, if you know you have allergies and they're really strong, then, you know, you can take your preventive measures with, like, anti-allergic medication and so on. But other than that, there are also natural kind of eye drops, like, for example, Actuin-based eye drops that can prevent a little bit. And also showering at night before you sleep actually helps reduce the pollen load.
That's really interesting. I did not know that. Good tip. But there's not anything we can do that you can that's going to get rid of it completely.
With allergies, like the best thing would be to avoid that, or get a hypersensibilization or something.
It is it's quite disabling when it happens. Now, when we're also thinking about the summer months, those of us that are here are often trapped inside for large proportions of the day. And I think both from adults who then are working potentially at screens, or children, they definitely end up having a little bit more screen time during the summer months. Have you got any advice to parents about managing that, and if there's any possible side effects that can affect the eyes from prolonged screen time?
I mean, my advice for that is the same that I would always have with screen time, right? Like the one advice that seems to really work is like the 20-20-20 rule. After 20 minutes of screen time, take at least 20-second break, look into 20 feet distance. And with children, I understand it's really, really hard to limit the screen time, especially in summer. But, we have to try our best to do so. There's not really, beside really trying to engage the kids in other activities, it's a little bit on us. And
but definitely frequent breaks is a key.
Frequent breaks is the most important thing.
What are they in danger of doing to their eyes? What are they actually risking by being on the screens for those prolonged periods of time?
I mean, look, on one hand, it's dryness, right, of the eyes, because especially children, they tend to do, I think, even us, we get a reduced blinking frequency when we are looking at screens. But children tend to do this. They stare at the screen until, those comics from the olden days where you have somebody looking at the screen, the eyes popping out and they're all red. It's a little bit exaggerated, obviously. But in children in particular, this happens often. And then, they are spending a lot of time in front of the screen and they're staring at them. And a couple of days or weeks later, the patients come in and or the kids come in with their parents, and the parents are like, oh, my kid is blinking all the time like this, right? Which is somewhat like a compensation mechanism that then kind of sticks along with them. But, reminding your kids to blink when they are using the screen, just like distract them a little bit, taking the regular breaks. And, when it comes to long-term damage from prolonged screen time, you have to think of it in a way that our eyes, when they're relaxed, they look into the distance, right? So they're conditioned to look into the distance. When we look into the near, it's actually work for the eyes, right? And if we do that, especially at this young age, at a very high rate or prolonged time, we're basically signaling that, this is the distance that we need. And it encourages short-sightedness.
Especially whilst they're in their growing phase of
We've seen this a lot during
Exactly.
COVID, right? There was a big rise in myopia and short-sightedness in children because of all the screen time, because of the homeschooling, where they were spending all the time.
Indoors. And we know as that outdoor activity and getting sunshine within a period of the day is very protective of short-sightedness as well, correct? I mean, that's some really, really good. I know it's hard for parents out there to limit that. And I think the idea of putting in schedules, so you can say, we'll do something and then we'll do something else, do some baking with them, just anything, right, that we can get them away from the screens.
So there are a lot of camps here in Dubai, like sport camps and things too.
Yeah, art camps, there's loads going on.
There's a lot going on in Dubai, which we're very fortunate to be honest.
And hopefully if people do get away for a bit, then the children are outside the whole time, which is great. Okay, so over the summer months, if you have a patient what would you say are warning signals of things during these summer months that you really shouldn't ignore? Because especially when people are travelling, if they become symptomatic, sometimes they just ignore it and think, I'll just do it I'll sort it out when I get back from my travels. But what are the key factors that really with visual health you shouldn't ignore?
You mean in general?
In general, yeah.
In general. Okay, so there are certain things that, there are not many things that are eye emergencies, right? But some things are, for example, like sudden loss of vision, or even when you suddenly feel like, I can't really see very well on one eye for a couple of minutes or something like that, then you should not ignore this. Flashes and floaters are always something that you shouldn't ignore because flashes and floaters can be a sign for retinal tears and detachment.
Yeah.
And it's not something, when it happens in the holiday that you're like, oh, I'll deal with it when I come back.
So any kind of visual disturbance should not be ignored. Absolutely. Yeah. And pain, I would imagine, as well. So if somebody gets sudden onset pain, then they should also come to get some attention quite quickly. Okay. But there's nothing specific that you can think of over the summer. Those things can happen any time of the year, I would imagine.
Those things can happen anytime. I mean, some things that you should also avoid is like sun gazing.
Yeah.
I know people used to do that. I don't know if they still do this. Try to avoid direct gaze into the sun.
And what happens to your eyes if you stare directly at the sun?
Well, the sun rays are really, really strong, right? And worst case scenario, they can actually burn your retina if you look too long.
So I guess like sunburn, but inside your eye, you could imagine it. So, so again, you would just suggest making sure that you're constantly, avoid even with sunglasses looking directly at the sun, but certainly not without any eye protection. Yeah. Great stuff. So as everybody heads off on their holidays over the next few weeks, if you would pack a kit for people for eye care, what would be in your magical travel? Exactly.
Okay, so definitely there would be sunglasses.
Yeah.
There would be sunblock, because you can put your sun protection around your eyes. You don't need a specific sunblock for that. You can really use the same one around your eyes. I know a lot of people suffer from irritation from the sunscreen because they feel like it makes their eyes burn. Nowadays, we're really, really lucky that there are really high quality, non-irritating, medical grade sun protections that you can use.
But a lot of people's makeup also does include an SPF. Is that okay? Or would you suggest making... Okay.
It's not enough, because the thing is, when you look at sun protection, if we're just looking at the whole face, right, you would generally would say, okay, you need 2 fingers, right? Like you put, or like a teaspoon or something.
Yeah.
Imagine putting that much makeup on your face.
Yeah, fair. Okay, so it needs to be a little bit more dense, so, if you will.
Yes, it's nice if your makeup has a little bit of sun protection, but don't use it as your main.
Okay, but you're saying it doesn't really matter if it's just general sun cream, because obviously the face sun creams are significantly more expensive.
I would use those because they're less irritating.
So that's what makes them the differentiating on the market. Okay, fair enough. So what else would be in your kit? So you've got your...
Right, we're not done yet.
Yeah.
So we said sunglasses, sun protection, definitely some eye wash.
Yes, exactly.
Some artificial tears.
Yeah.
Me personally, I would probably have a bottle of antibiotic eye drops as well.
Antibiotics, just in case
you get an infection. Because in Europe, you need a prescription for that.
Yeah.
But, that's just me.
Okay. Yeah. Okay, I think that's really helpful to everybody listening. And then as we just sort of wrap up, have you got any other advice just for families in general over the next few months that are kind of your key eye health advice points?
Well, as I said, try to reduce screen time as much as you can. Take regular breaks from your screen. Have your sunglasses, your sun protection. Enjoy the summer. Yeah. Go out if you can, if you have the chance to. Use your goggles in the pools and in the sea. And don't use ever contact lenses in your water.
Absolutely. That's really great. Thank you so much for all that amazing information. And I think we can all wish everybody a lovely summer.
Thank you. Thank you so much.